All right. Hello. Good afternoon, everyone. Thank you so much for joining us for this important COVID-19 town hall update as we prepare to welcome students back to campus on Monday. I'm Morgan Aguilar, a grad student and communication specialist here at the U. And before we begin, I want to remind everyone that all of the information that we'll be going through today can be found at coronavirus.utah.edu. That continues to be our primary site for all things related to COVID-19. And as we know, this information is rapidly changing, and we will continue to keep that site updated. You'll also find important updates at theu.utah.edu. That's the university's main campus news site where we post leadership statements, research breakthroughs, and much more. So you'll find those highlights in your inbox every Monday morning. But that website is updated with new posts daily as well. So let me introduce our speakers for today's town hall. I'm joined by President Taylor Randall, Dr. Michael Good, our Senior Vice President for Health Sciences, Dr. Martell Tealsey, Interim Senior Vice President for Academic Affairs, Dr. Lori McDonald, Vice President for Student Affairs, and Jeff Herring, our Chief Human Resources Officer. So there is a lot to talk about as we begin spring semester. While we know concerns surrounding COVID-19 and the Omicron variant continue to rise. So from health protocols to potential staffing shortages, we're going to get to all of it. And first, I'll hand it off to President Randall to kick us off with a welcome. President.
Morgan, thank you very much for that introduction and getting this town hall going. And good afternoon, everyone in the University of Utah community. Happy New Year. It's exciting to be back for another semester. And I just want to take some time to congratulate everyone that made it down to the Rose Bowl and cheered on our Utes. We were a little disappointed with the final minute, but we had over 19 million eyes on us in those last few minutes of the game. And that was an exciting moment for the University of Utah. You know, we've got some serious things to talk about today, and I want to try to lay out a little bit of the philosophy that that we want to take together as a community as we kind of work through this version of COVID-19. I want to take a few minutes to try to appeal to that philosophy and try to set a little bit of a context for what we want to do. But before I do that, I just want to thank everyone for your remarkable efforts. We are on our 7th full semester of disruption from COVID. I think it's time we reflect on the remarkable progress we've made, the things that we have learned. We have a highly vaccinated community here. I think we're going to be 94% or so vaccinated among the student body when all is said and done, and similar levels among our faculty and staff. And so that's just actually tremendous. I also want to thank you all for the time and effort you've taken to learn new teaching pedagogy and new methods of delivering classes. It's truly been inspirational. And then I think the other thing that I hope you all take some time to reflect on are the individual interactions that you've had with students and the difference you've been able to make in their educational experience over the last little while, and also the time you've taken and the care you've taken with colleagues to help them through many of these difficult times. It's going to be tough for a few weeks. There is no question about it. And I think we're going to have to figure out as a community and learn even more. And we've got to dig deep and find some resiliency to make it. But I know that we can, because we have in the past, and we've learned a lot. And I think we now have some collective wisdom that we can bring to decisions that we didn't have 7 semesters ago. I've shared this with some of the colleagues that are probably on this. I recently read an interesting article. It was a sociologist out of Yale that looked at shipwrecks and how groups of individuals actually survive shipwrecks. And they ran the statistics, and you know, the gory, I guess, metric here was who survived and who didn't, and then to try to examine why people survive and why they didn't, and how communities can actually build during these times of stress and anxiety. And I just want to relate one anecdote that was, I think, kind of interesting from this study. And there was an island somewhere in the South Pacific with an impassable mountain range, and there turned out to be a shipwrecked on each side of the island, and they actually did not know that they were there. So the same basic physical conditions, didn't know that they were there at almost the same time period. And interestingly, one group survived almost in its entirety, and the other group, only one or two did. And so they took a deep dive into what happened there. And it was interesting to see the group that didn't survive. It almost started from the very beginning. One of the leaders of the group decided they were going to go back for a chest of money and leave people behind for the money. So an act of empathy or lack of empathy started really a disaster. At that point, it was all for one, and the society unraveled. Yet on the other side of the island, the same circumstance, and the group of people decided to go back to the shipwreck and bring everyone along. And that act of empathy ended in a spirit of community and a spirit of community compromise that allowed all of them to survive. I think it was a year to a year and a half that they were on this island. So I think we're going to appeal to the survivors and the lessons they learned, in that they approached their circumstance with an attitude of empathy for different viewpoints, and they found compromise. And as we kind of lay out what we're trying to do to navigate, those are the two principles I think we've been trying to use, and try to use those as we navigate really a set of regulations and laws and health restrictions and risks, where a lot of us have very different views. So I don't want to make this too simple, but let me just kind of articulate the way we've been looking at it. We face rising COVID cases. We know we've got vaccinations, but it's still a serious illness. We also know that we have a group of faculty and students that would prefer not to be in front of each other because of the spread. I talk daily to people from all over campus, and I also hear from a group of individuals that equally strongly want to be here on campus, and they want to be teaching and working in person. And they have similar reasons. It's for things like mental health, and I learn better, and I feel like I'm missing out on education. In fact, I was at a meeting this morning where somebody quoted the Surgeon General to say, you know, we've got two pandemics going on. One is the pandemic, the other is actually a pandemic of loneliness. And so we find ourselves, right, with these two opposing views. And I think our philosophy is we need to show empathy for each other, and we need to be understanding that there are people that are prefer not to put themselves at risk, but there are also people that want to. And then you juxtapose that on top that we have been asked by the state to have 75% of our classes in person. And so we have to start with that proposition that we will 75% be here in person, and we will be opening in person on Monday. But we want to try to craft a compromise and be empathetic to each individual circumstance. Those that are actually at risk and have family members that are at risk, the legislative guidance gives us 25%. And what we have been trying to do is to allow deans and leaders and faculty to have conversations about using that in creative ways so that we maintain a 75% in person, but we also help protect those that need the protection at the same time. And with that compromise, we hope we can make it through it. It's going to be difficult. It's going to be rocky. We're going to be understaffed. We're going to have some difficult times. But I've been impressed by your collective wisdom and your ability to work through it and to be resilient. And that's the way we want to try to get through, this moment, and particularly the next 4 to 6 weeks. I hope it doesn't go longer than that, but I'm obviously not a prognosticator of this type of pandemic. But I'm hopeful and confident that each of us will be able to make the right decisions for ourselves in consultation with those that have to kind of keep track of if we're kind of in compliance. again, I think what we're trying to trade off here is the individual health of individuals, but also the needs of many that feel like they need to be in person for learning and for their own mental health. It's hard to over or understate one or either of those sides. And so the spirit here is a spirit of compromise, a spirit of trying to understand within the constraints of the current law. I have confidence in you. We're going to turn the time back over to Morgan right now. And we're going to take some questions that have been sent to us, some very common ones. We'll be laying out what we're trying to do over the next few weeks. But let me just tell you that this community has always been a community of great empathy and compromise. And I appreciate that. And I thank you. And I appreciate you and love you for what you do in bringing that spirit to us. So anyway, with that, Morgan, I'm going to turn it back over to you.
Thank you. Thanks, President Randall. Resiliency, flexibility, empathy, compromise. I think these are all key terms and themes that are going to come up as we jump into these questions. I do want to thank everyone who submitted questions in advance. That really helps us to make sure we touch on the things that are mattering most to our campus community. So our first question is for Dr. Good. What do we know right now about the spread of this Omicron variant in Utah and on our campus?
Thank you. So as we have with other variants of coronavirus throughout this pandemic, we talk about transmissibility and virulence. So transmissibility, how does the virus spread? How does Omicron spread, and particularly in comparison to previous versions of coronavirus? And its virulence, how severe is illness for those who are infected with Omicron? So let's start with transmissibility, and I want to thank Dr. Zhang and Dr. Seymour, who are in our Department of Epidemiology. They help us by calculating a so-called reproductive number. And what that means is each person who has an Omicron infection, how many other people do they infect? And for those of you that have followed through the pandemic, for the vast majority of the time, the number has been a little below 1 when transmission was speeding up, or a little below 1 when it's slowing down, when we're slowing down transmission. Right now, the reproduction number for Omicron, the dominant coronavirus circulating in the community, is up over 2. That means each person who has a Omicron infection, on average, infects 2 other people, and those 2 each infect 2 more, to 4, and 4 to 8, and so on. And you can see how powerful that multiplier effect is. So Omicron is highly transmissible, more so than particularly Delta and Beta, the earlier variants that we dealt with in this pandemic. So now let's talk about virulence or severity. And Omicron now, with gathering evidence, is less severe than particular a Delta variant infection. And actually a study that was just recently published in Nature begins to help us understand why it is a less severe infection. And it has to do with the specific changes, the variant, the different gene sequence, and the changes that result in the spike protein. Those changes, so the virus is more transmissible and it gets into our throats and our sinuses, but our lung tissue, those changes on the spike protein make our lungs more resistant. Omicron is not as good getting into our lungs as Delta and the earlier versions. And recall, certainly here in our hospital, we've dealt with the pneumonitis and the pneumonias. The lung disease has really been a key part of why, particularly with Delta, individuals can get so sick. So with Omicron, it gets into the sinuses, the throat and the sinuses, but our lungs are better at it. It doesn't get into lung tissue. Our lungs are better at keeping it out. And so that's why we see this less severity. Now, the problem is the transmissibility, the multiplier, if you will, is a lot higher. There's so many people passing Omicron around by that, as that reproductive number shows, that we're still seeing significant impacts on our health system. So let's review first statewide. At 2 times during this pandemic, we got up to the point where 600 Utahns were in a Utah hospital with COVID-19, 600. Heading into the latter part of last calendar year, that came down to 430. So from 600 down to 430. As of yesterday, there were 536 Utahns in the hospital with COVID-19. So 600 down to 430, we're back up to 540. So we still are in an area where we have capacity, but we're beginning to approach some of those higher numbers that we've seen twice in the pandemic before. And as we speak, the Utah Hospital Association and our colleagues, as we have done throughout the pandemic, are working together to come together to make sure we use all of our resources collectively to care for patients who need to be hospitalized with COVID-19. A very similar story here at University Hospital. Peak parts of the pandemic, we got up to about 95, just under 100 COVID patients. We came down in parts of the summer. Most of the fall were between 60 and 80. And then we're very pleased as we head into Christmas to see we went down into the mid-20s. Over the last week and a half, we've come back up to about, actually this morning, there were 73 patients in the hospital here at University Hospital with COVID. So again, 100 came down into the 20s. We're now back up at 73. So we're in a range where we're caring for everyone who needs it, but we're beginning to move up toward the upper end of that range. We have been impacted by this easy transmissibility of Omicron. And right now we've got about 600 of our team members at University of Utah Health who are either out ill or many of them are at home because they've tested positive and they need to wait their 5 days. We'll talk about that in a minute. They need to wait their period before they return to work. So we have made some adjustments. For example, today we're doing ambulatory surgery, but we've really reduced the number of surgical procedures where a patient is going to be needed to be admitted to the hospital following their surgery. We, of course, continue to do urgent and emergent procedures and surgeries and interventions, but we are doing the things we need to do as a health system to make sure that with while our staff are out we have reduced staff because they're out ill, that we're able to prioritize the patients with the most urgent needs, of course, keeping track of everything so that we can then loop back as this wave passes and then catch up with the healthcare that everyone needs on a less urgent matter. So again, we're in the higher part of our range, but we're below where the peaks we've been. And I just want to thank all of our team members, particularly those at University of Utah Health, for all the things you're doing to make our pandemic response possible.
All right, thank you, Dr. Good. And I think that information and data obviously highlights the importance of all the health and safety protocols happening on our campus. Dr. Tealsey, does this Omicron variant change the safety and health protocols that we have on our campus? Go ahead and unmute.
Thank you. I think that's the word of the year. Go ahead and unmute. Thank you for that question. I want to thank Dr. Good and President Randall and echo President Randall's words and say Happy New Year to everyone, and really want to thank our dedicated faculty and staff for their continued efforts and concerns. And we're certainly concerned about the well-being of everyone here on campus. In terms of the variant and our safety protocols, they're basically the same. With Omicron, our health and safety protocols remain in place. We're still asking everyone to, one, get 2 doses of an improved COVID-19 vaccine plus the booster. And being fully vaccinated now means having a booster shot according to the CDC. Secondly, If you're not vaccinated, please get tested weekly. And that testing is available. I got tested yesterday on campus and got the results in less than 12 hours, just to let everyone know they were negative. Please follow CDC guidelines, thirdly, and wear a mask when indoors. Now, I know there are individuals that don't like masking, but I was given a term yesterday by someone that I think I'll adopt now, which is compassionate masking. And so that is the case that if we don't believe in the virus itself and some of its deadly effects that scientists have told us about, please consider others, not just ourselves, and mask for the health of others. But I will say, please mask for the health of ourselves. Fourth, we should self-report positive cases, participate in contact tracing, and again, follow CDC isolation quarantine protocols based on our exposure. Dr. Good will talk about the 5-5-5 rule there. And again, as we go forward, these same methods should be repeated. I'll stop right there.
Yeah, thank you. And so we know that many are concerned about classes, going to class, teaching in classrooms. Dr. Tealsey, the Academic Senate met this morning to discuss their COVID-19 concerns. So can you talk a little bit about what came out of that meeting, and especially touching on what options are really available to faculty, instructors, and students in not only holding those classes, but attending their classes in person?
Thank you. I met with the Academic Senate this morning. It was a good and robust discussion. They've adopted a 5-point resolution. I don't have it totally in front of me. Most of it is still the same. Some of it is very symbolic in terms of things we're already doing. They were requesting flexibility for faculty and instructors to go remotely. Now, we cannot wholeheartedly do that, as President Randall talked about. The House Bill 107 mandates that we have 75% of our classes in person. But please remember that's pegged to our fall 2020 class sessions. And so in my own college, the College of Social Work, that actually meant 69% of the classes in session to be face-to-face. And so deans are empowered to make those decisions. Should someone test positive, or if students are having difficulties, the dean has the ability to determine, are we within the parameters of that 75%, and have people mask, as well as to flip classes online for a specific time. They also wanted to have mandatory masking. Now, according to the state law, we cannot have mandatory masking, but I've seen different types of tactics in classrooms where particularly an instructor at the start of class basically says we're going to all don our masks, which puts peer pressure on students. And that's no panacea, because there are some people that still won't put masks on, but it does put pressure on individuals, and most people have complied with that. And there has been robust discussions within class about masking. They also want to encourage support for working remotely. We cannot do that wholesale. We can do that in situations where people are immune compromised or have loved ones who are immune compromised and are afraid of them gaining exposure. Now, the other thing is that in doing so, we want people to continue to get tested. We don't want people who are ill or feel that they have been impacted by COVID to come to the university or the classroom. And in those situations, deans and department chairs can decide appropriately what's the best course of action in moving forward. So a real robust discussion. Much of what the Faculty Senate has adopted in their resolution is very similar to measures we're taking already. Of course, some of them are out of bounds, but again, everyone is concerned about keeping people safe.
Thank you. Okay, we've referenced the 555. We know there are some new isolation and quarantining guidelines. Dr. Good, could you explain those?
Sure, and this is an area throughout the pandemic we've had to keep up with, because as we learn more and as each of the variants behave a little bit differently, the CDC guidance evolves over time. So where are we now currently with Omicron as we head into the spring semester? And we are, I think, working this, you'll hear this term 555 is a way of helping us remember the steps in isolation and return and so on. So first, I'm going to talk about if you test positive. So if you have tested positive for coronavirus, the first 5 is you need to isolate from 5 days from when you were tested. So if you get a positive test, a home test, a molecular test, a laboratory test, if you test positive, you need to isolate yourself for 5 days. You have the potential to spread that coronavirus to others. And you need to isolate even if you don't feel symptoms or sick yourself. Like I mentioned, Omicron lives up in the sinuses and the throat, but doesn't get down in the lungs. You may not even know you're carrying it. So if you test positive, isolate for 5 days. If you're still having symptoms on day 6, you continue to stay isolated. On day 5, if you're not having symptoms, or when your symptoms finally go away, and perhaps the keys, for example, obviously the sore throat, the cough, and so on, but a good measure is if you're not having a fever for 24 hours without taking medication to reduce the fever. So after 5 days of isolation without symptoms, or after your symptoms are gone for 24 hours, then take a COVID test to make sure you are no longer spreading the virus. Even if that test is negative, you should continue to wear a mask for 5 more days after your isolation ends. So the 3 5s, if you're positive, isolate for 5 days, take a test at day 5, and then continue to make sure you're not continuing to shed the virus, and then continue to wear a mask for 5 more days after that. 5 5 5. So that's if you test positive. 5 is also now an important number if you're exposed. And this is what we'll expect on campus, because we do know team members will test positive and will have been around them. So here's the protocol if you're exposed. If you're exposed, you're around someone who was later found to have been tested positive for COVID-19. If you're fully vaccinated, including the booster, you need to wear a mask for 5 days. You don't need to quarantine if you're simply exposed and fully vaccinated with the booster, but you should wear a mask for 5 days. If you've not been vaccinated, including if you've not had a booster, you actually do need to quarantine for 5 days to make sure the virus hasn't spread to you. So that's why that booster is so important. There are going to be a number of exposures on our campus and in our community in the coming weeks. If you're boosted, you just need to wear a mask. If you're not boosted or not vaccinated, you actually have to do the 555 protocol as if you were testing positive. So I know I've thrown a lot of 5s at you. Again, as Morgan has pointed out, this will be posted up, and we'll do our best to help communicate the current CDC approach to both testing positive or being exposed to someone who is tested positive.
Yeah, thank you. So I do want to remind everyone, we know this is a lot of information, so we will post it to coronavirus.utah.edu, and we're also going to post this town hall and all this information at theu.utah.edu, so you can always refer to it later. So we'll go now to Dr. Lori McDonald. We know just from past experience that our student housing community will likely feel the impact of this upcoming surge. So is there anything that you want to mention to our HRE students and parents specifically?
Thank you so much. Yes, we know our students who live on campus, although we have, one of the beauties is that we have a variety of living opportunities. Some students live in single rooms, but most of our students live with a roommate in a double room, and some are even living in triples. And so with that more densely populated living situation, we do know that just as we've mentioned here, we are, in addition to our classrooms and our programs, certainly our living on campus situation is going to be very impacted by this situation. So as always, there is often communication directly to the students who live on campus through a variety of means, directly through their email and through social media platforms specifically for our students living on campus. And there will be very frequent communication from housing and residential education with ongoing protocols, with ongoing updates. We, just as we're asking all students to follow these protocols when they're on campus and wherever they are, we also are really encouraging our students living on campus to be vigilant about the protocols where they're living and be supportive of one another. And I would suggest not just for our students living on campus, but all of our students checking in with each other, just as we have suggested. You know, that was powerful when the president pointed out that this is our 7th semester that we are dealing with this. And we know that being there for one another in just supportive reaching out, either electronically or when we can in person with care, is really important for all of our mental health and getting through this. So thank you.
Yeah, thank you. And one more question as it relates to students. Will students be required to get that booster during spring semester?
Yes, thank you. With that update, just as when the COVID vaccine was added to our vaccine requirements last semester, very similarly, we are adding, under the guidance, the requirement for the booster to be considered fully vaccinated. So the details are coming out and again will be communicated directly to students. But so for our brand new students this semester, they will have guidance on how to demonstrate compliance with all of our vaccine requirements. For our continuing students, it's very similar to what happened last year. If they received the vaccine booster in the state of Utah with the state system, it will update ours, and otherwise students will be able to upload their vaccination record through the portal in the Student Health Center, but we'll communicate directly with them about what those boosters are, what the timing is required. But I do want to mention to everyone, not just our students, that there are vaccines available on campus. Students can make an appointment directly with our Student Health Center if they'd like to receive it there. Faculty and staff can certainly go through my chart and find options that way. But all of our campus community have access to free vaccine clinics that are starting up again next Thursday, January 13th in the Union Building, as well as the vaccine.gov website nationwide. So there are some options for boosters. We have both the Moderna and the Pfizer boosters available at that vaccine clinic.
Thank you. And sticking on vaccines, but switching to staff and faculty, Jeff Herring, why isn't the U requiring faculty and staff to get vaccinated?
Thanks, Morgan. I appreciate that. I want to add my thanks to everybody as we get through all this as well. But the question is, why not faculty and staff? As all of you know, we are a public institution here in the state of Utah, and as such, we are an entity of the state of Utah. And so it's always this dance going on between the requirements of where we want to go and where we can go according to statute, rule, policy. Because we are a state agency, state entity, we will follow the state legislative guidance and state leadership guidance on that. We are always keeping abreast of the federal requirements. Some of those are being heard in Supreme Court today, and rest assured our government relations is working closely with that group as well as the group in the state to see where we go in the future, but we're monitoring it. But the thing that I want to emphasize with that, even though that students are allowed for that and faculty and staff are not right now, I think it's been mentioned a couple times by the president, Dr. Good and Dr. Tealsey, that we are very fortunate here on campus to have a very high vaccination rate for our campus community, including faculty and staff. So that's very beneficial to us, Morgan.
Thank you. So we'll transition real quick from vaccines. Dr. Good, what is new on the testing front this semester? Who can get tested, when, as well as where?
So we continue, as we have, to make testing available to our faculty, staff, students, and their families. But what's new, and I'm very pleased to report, is that we'll be offering self-serve testing kiosks. So first off, this testing, a large part of this testing is accomplished actually in our research gene sequencing core. And I really want to thank Cameron Wright, John Phillips, Derek Warner, James Cox, and an army of many behind them who just provide hundreds and thousands of COVID tests for us. They're PCRs, they're highly reliable, and we're very fortunate to have this team. But what the team has done now, starting next week, is that asymptomatic, again, faculty, students, staff can begin to be tested at these self-serve kiosks where you can pick up and drop off your testing sample. Again, these are PCR, they're molecular tests, they're saliva-based, so no nasal swabs and so on. And as Senior Vice President Tealsey just mentioned, most days you get the test back that same day and almost always the next day. So really rapid turnaround time. The testing centers, as you know, they've been appointment, but the kiosk, there's no sign up necessary. It's free. You do need your UID. That's the magic card. I remind you, you shouldn't eat or drink 30 minutes before you provide your sample. And again, these are going to be our asymptomatic testing centers. People that are symptomatic should go either to the symptomatic testing site at Fort Douglas or to their healthcare provider. So we're going to add this self-serving aspect to the coronavirus.utah.edu. You'll see the locations. There will be instructions there. I think 3 of the kiosks go operational on Monday, and then there's plans for 4 more to be added very shortly after. We do continue the in-person asymptomatic and symptomatic testing at the Fort Douglas site. There are separate, we separate symptomatic from asymptomatic. Those are appointments by schedule, and they're at coronavirus.utah.edu. I've been there many times, and it's a great service. I again thank our team. But again, self-service kiosks going active on Monday.
Thank you so much. I think that's a really exciting update, and I can't wait to take advantage of them and skip some of those long lines that we're seeing in our community. So at this time, we want to be respectful of everyone's day and time. I know there are a lot more questions that we didn't get to in this town hall, but there is information completely always being consistently updated at coronavirus.utah.edu, as well as check for updates in at the u.utah.edu. So for now, I want to hand it back to President Randall for some closing remarks.
Morgan, thanks for facilitating this town hall, and thanks for everyone that's participated. We do owe a great deal of thanks to our healthcare providers here on campus and those that are providing this innovative testing technology. Thanks for the countless hours you've spent. We do spend time each week analyzing our COVID situation. We are in constant contact on a daily basis with city and county and legislative leadership and the governor to try to make sure we're staying on top of this evolving situation. As you know, the COVID regulations changed just a few days ago, and we're adapting to those new recommendations. I'm confident that we can craft the right compromise here with empathy and compromise. We'll be able to get through these next few weeks. They won't be easy. We hope you'll communicate with us. We hope you'll communicate with leadership in your individual units and colleges and departments. We hope that they feel empowered to be able to help to try to manage through these next few difficult weeks. This is another step in us learning how to live with COVID-19, and I just deeply appreciate our community and for the goodwill that exists. Particularly want to thank the Senate for taking time to meet today. Their recommendations were certainly, I think, in the spirit of kindness and in the well-being of our community, and hope that we can reach compromise to make it through this. So thank you very, very much, and have a great afternoon.